everyone, welcome to the Voice of Nursing. My name is Adrian Tracy, CEO of ICG Medical. Today we're joined by Kristin Ferguson. Kristin, welcome to the Voice of Nursing.
Thank you so much, Adrian.
Kristin, tell us a little bit about yourself and how you got into nursing.
So I've been an oncology nurse for 10 years. That's been my whole nursing career. I went directly into nursing from high school. So in high school, I was a nanny for an autistic boy and his little brother. And that was, basically babysitting with a little bit of extra medication giving and education for the little boy. But I got really close to his family during that time, and it made me think about nursing as a career. Because I liked being involved in the caring aspect with him and his brother, but as well as interacting with the whole family and being a part of a team. I also, in high school, volunteered with the Red Cross at a local hospital, mainly just shelving records, nothing very technical about it, but I really liked going into the hospital, and I thought, this is a place I could see myself working in the future. And so when it came time to apply for college, on your college applications, you're supposed to check a major. And a lot of people are undecided, but I thought, I'd rather try something out. And so I applied for nursing schools. And I only applied to colleges that had nursing schools. And it worked out really well. I know a lot of nurses that are second degree nurses or came into nursing later on in their adult years, and I think it's wonderful. And a lot of people are surprised that I picked nursing on the first go around. But I'm very, very fortunate that it worked out well for me.
Super. And how did you, obviously you MASH oncology specialist, how did you end up in that sort of that oncology area?
Well, I remember actually a day in college where one of the professors asked us in a large class, what specialties do you guys want to go into? I just want to get a sense. And a lot of people raised their hand and said pediatrics, and some people said, I want to be a nurse practitioner, and they said different specialties, and no one said oncology. And I raised my hand and I said oncology. And the reason I wanted to do that from the very beginning is because it had that same sense of what I felt in high school when I was babysitting. You are really a part of a team, and you get to know the whole family. It's a very long illness. It's not something where people come into an emergency room and then they leave and they're cured or they're healed. It's a very long journey where people have to usually get surgery or chemotherapy, multiple test results. It can last many months or years even. The whole family is involved. And I really like that aspect of nursing, because you're not only using your technical skills and your scientific background, but you're using a lot of emotional intelligence as well, and educating the patient and their family, as well as providing them that support that they need during a really difficult time in their life.
Always amazes me the nursing skills from the softer skills.
Mm-hmm.
And how do you learn how to have those interactions with the families?
I really think it takes practice. Some people might be very intuitive. I think that it is very difficult, though, to talk with people and their families when they're incredibly upset, don't want to be there. I always somewhat joke with families. I say, no one wants to be here, but I'm glad to be working with you. And when I was working actually inpatient at a hospital, when people were discharged, they would still have cancer, but I would say, I hope I see you again, but I hope it's in the grocery store, and I hope you're not back in the hospital. And they would always laugh and agree, and they'd say, yeah, it's been a pleasure working with you, but I hope I never see you again here in the hospital.
Fair point.
But working, outpatient, meaning people are coming in for appointments regularly, you see them all the time, and I think there's just something really special about creating that bond with people and their families and getting to know them, and then realizing down the line, like, wow, I've been seeing you for a couple months or a couple years, and hopefully, they get better, and if they're not metastatic, and you only see them then for regular checkups, and it's like, oh wow, you're a brand new person. I haven't seen you in 6 months. But for those that end up with more advanced cancer, you're there for them during a really, really critical point in their life.
And what would you sort of say in your role now that the sort of most challenging, sort of interesting part of the job is?
So right now I work at MedStar Georgetown University Hospital Lombardi Comprehensive Cancer Center as a clinical operations manager and nurse manager. So that is a mouthful, but what it basically means—
I'm glad you said that. I couldn't get that right.
I've had a lot of practice. But I do mainly two types of roles. I am a nurse manager, so I help manage our team of nurse navigators and coordinators. And those nurses, who I was previously a part of that role, they help coordinate patients who have been diagnosed with cancer and need help learning about their chemotherapy, the side effects of treatment, how to manage those side effects, sometimes how to pay for treatment, so helping to get insurance prior authorizations for medications. As well as kind of serving as a link between the patient and the physician. So the patient's coming every couple weeks for treatment and for appointments, and in between the times when they're seeing the physician, they can contact our nurse navigators and coordinators and talk to them about their problems that they're having, and the nurse can reach out to the physician and get feedback if they're not able to help the patient manage the symptoms with the resources that are in place. And so I manage that group of nurses, which is very satisfying for me professionally, because I like being able to help nurses that are helping a very wide variety of cancer patients. I think that management, you need good management in a role like that can be very stressful and emotionally taxing at times.
I was going to say, then carry on, sorry.
And then the other part of my role is patient experience. So we want to provide the best patient experience possible for patients. They're going through a really difficult time. And so helping them to understand how the way our systems work, helping to make our waiting room nicer, helping to talk with them when they have concerns maybe about the care they're receiving, or they're not understanding how our processes work. And so it's an interesting role to combine those two functions.
I was going to say, talk us through moving from that sort of specialist area into more the leadership field now.
So I started off working at inpatient, so with patients that were getting care for their cancer after surgery. And I did that for a number of years. And I actually went into leadership at that point. I was a manager on that same floor. And then eventually I wanted to move outpatient, meaning seeing patients that are coming in for treatment but not staying in the hospital. So they're coming in for either chemotherapy or to see their oncologist. And the reason I moved in that direction is because I wanted to see patients more long-term. So patients typically aren't admitted over and over again, and you see them for a long period of time. They're kind of just short stints or several days worth. But outpatient, you get to know people for years. And so I felt that when I moved in that direction, I definitely became more specialized in oncology, because I got to learn more about the chemotherapy cycles, about the whole kind of cancer spectrum. So when someone is diagnosed, they meet with their oncologist. They might have surgery or chemotherapy or radiation, and then after that point, they either continue treatment if their cancer is advanced, or if it's in remission, then we see them every couple months just to follow up. But they go into a period of what's called survivorship, meaning that they are kind of cancer-free, but there's always a chance that it could come back, and we still need to support them and help them hopefully prevent that, as well as monitor for any symptoms that may signify that it's come back. And so I really didn't learn about all of that until I specialized further in my career and went outpatient. And so specialization is very important, because another nurse, like a pediatric nurse that doesn't work with cancer patients, or an OR nurse who works in the operating room, they're not going to have the same knowledge of chemotherapy and cancer cycles and the biology behind it that the nurses in our cancer center have. And so we're able to provide patients with the best support and education because we have that knowledge.
And so obviously you're a specialist nurse and the work you're doing, but you've congratulations on your recent appointment to the board of directors, the Oncology Nursing Society, as the treasurer. Very important role. How did that all come about?
So ONS, the Oncology Nursing Society, is a specialty group in the United States, and it has approximately 40,000 oncology nurses that are members. And it's based out of Pittsburgh, Pennsylvania, but we have local chapters all over the country. over 100, where local educational meetings are held every month. There's local boards that help run those, and oncology nurses of all different fields, meaning they might be a radiation oncology nurse or a chemotherapy nurse or a nurse navigator, they can all come together and learn. They can sit at dinner and kind of learn about a new chemotherapy drug or a new way of treating colon cancer. Various topics. And the professional organization is wonderful because it provides a lot of education for our members, as well as leadership opportunities and networking. And so I happened to be, several years ago, I ran for the local board, the National Capital Chapter, and I was president of our local board here in Washington, D.C. And so it was just a wonderful experience for me, getting to see the ONS from that viewpoint and being able to help organize meetings and encourage people to apply for scholarships and increase their education. And so last fall, they put out a call for people to run for the national board, and you could submit your name and CV and several professional references and essays, and I had to record a video, and it was very extensive. And an ONS has a leadership development committee that reviews all of that and then sends it to the current board, who selects who's going to be slated as a nominee. And then, and the whole process took about 5 or 6 months, because I applied in the fall and I didn't find out until late February, I think, that I was elected as one of the board members. And so I was then appointed as treasurer. And so what I'll do is I'll work with 9 other board members to help kind of decide the direction of the Oncology Nursing Society, and move our organization forward and continue promoting oncology nursing and quality care for cancer patients.
Very good. And what are the sort of 3 main themes that you're working on at the moment, or the future for the ONS?
Well, we always want to increase education for our nurses. There's a lot of new technologies and medications coming out in cancer, which is just wonderful. Immunotherapy in the last few years has really changed the landscape of care for our patients, and we need our nurses to continue to be educated and up to date with that, so we can care for our patients the best way possible. And so ONS is supporting education for our nurses, as well as leadership opportunities and networking. It's really important for a profession that has such a risk, I'll say, of burnout, that we support each other, and that we help each other understand when we can do a better job and better support our patients. And so it's a great organization where we're doing a lot of different projects.
And obviously, you must have seen quite a lot of change over the last sort of 10 years. The development's been, especially in that area, oncology has been massive.
Yes, definitely. For example, a lot of people don't know that chemotherapy can come in an oral form. A lot of people think chemotherapy is just intravenous, but there have been a lot more oral oncolytic drugs that have come out. Now, that's not to say that every IV chemotherapy can also be put in a pill, unfortunately, but a lot more new therapies that are emerging are pills. And so with that comes different complications that we haven't previously seen, such as perhaps people not taking them correctly and that affecting their disease, or a risk of them, they're not coming as often for treatment in the cancer center, so they may not be telling us of their symptoms as often as we would like. And so there have been a lot of research and articles coming out on how to help prevent these issues. And I know that it's a very exciting field to be a part of, because just little simple things like this that are making a big difference for cancer patients, because they don't have to come maybe as often to the cancer center, still can lead to other challenges.
So you're managing both, there's a positive aspect, but also a negative, isn't there, I suppose, in each one?
Mm-hmm. Yes.
What's your role? You also work in the Pancreatic Cancer Action Network Outreach Chair.
Yes. So
You like long titles.
I know. So when I was still an inpatient nurse, I had a lot of patients with pancreatic cancer. And so I learned of their organization during that time. And they're a wonderful group that helps people who have been diagnosed with pancreatic cancer and their family members learn more about the disease, learn what treatment options there are available, including research trials. And ultimately, it helps to raise money to fund more research for pancreatic cancer. Currently, pancreatic cancer in the United States has only a 9% survival rate at 5 years, which is very low. So it's a very deadly cancer. But the PanCAN, what we abbreviate it to, so it's easier to say, PanCAN, the Pancreatic Cancer Action Network, helps to create hope for patients and their families and provide a support system. And so I started volunteering with them a few years ago. They have something called a Purple Stride, which is a 5K that is once a year, and they have them all over the country. And so you can fundraise money for that. And then unfortunately, a little over a year and a half ago, my own mother was actually diagnosed with pancreatic cancer. And so, that was really hard for me. And luckily, she's still doing well and she's on treatment. But I've actually found that that group that I had already been a part of was a big support system for me. And so I feel more empowered when I'm volunteering with them, because not only can I share my perspective as a family member and a caregiver of someone with pancreatic cancer, but also as an oncology nurse. And so I found it a great group to participate in.
And another role you're doing, you're also the Helpsy Health Clinical Advisor. Tell us a bit about that.
Yes. So Sangeeta Agarwal is the CEO of HelpCE, and she has created a platform where we are combining nursing and AI technology, artificial intelligence. And so what I'm doing with them is helping to create an oral chemotherapy module. So I'm working right now on helping to build, meaning just kind of import data on oral cancer drugs, so that eventually patients will be able to access that information through their platform.
AI, always interesting.
Yeah, it's very interesting. It's not something I ever thought I would be a part of as a nurse, but it's a volunteer opportunity, and it's been a wonderful experience.
Fantastic. And if you're looking back now, obviously, highly successful career, and it's been amazing listening. What advice would you have given yourself, when you were starting back there at high school?
Oh gosh. I would say that I think self-care is, it's talked about a lot, but I don't think it's done well. And I think that it's important for nurses in the very beginning to know that it's important to get, enough sleep and have rest times with your friends in order to prevent the stress that can come with being a nurse. Because I know my first few years were stressful learning the profession. And I think that's not just in oncology, but that's just in nursing in general. And I know I knew a lot of nurses that left jobs, after a year or 2 years, and maybe they went to a different type of nursing, but it's a difficult profession. And so you want to make sure that right from the beginning, you're incorporating exercise and good sleep and good nutrition into your routine. That way you're able to take care for yourself and you're able to better care for your patients.
I agreed. Yeah, I think we were talking to an earlier interview about burnout, and how that's such a big challenge in the nursing community, and almost as if not having a break, not going to be able to the toilet or having any lunch, or it's almost like a badge of honor. And actually, it's actually not a good thing.
No, absolutely not. No. And I definitely saw it in one of my previous jobs. People would really work very hard, and it's, you want to be able to care for your patients, but you have to care for yourself first. Like on airplanes, they say you have to put the oxygen mask on yourself before anybody else, because if you don't, how long are you going to be able to care for others? And you're not going to be.
Yeah, we need nurses to look after each other so they can look after the rest of us.
Absolutely.
And obviously, as you said, you went into the oncology specialism, and there's loads of specialisms around, and nurses are moving into different areas. What, new nurse coming out of college or what have you, looking for a career, why would they look at oncology as an opportunity?
It's a wonderful career because no matter what type of oncology nursing that you're doing, you're always going to go home and feel like you made a difference. And that you could say that about most, I would say maybe all specialties in nursing, but it's particularly in oncology nursing because you're not only helping the patient, but you're helping their family. And I think that, caregiver help and watching over caregivers is something that we don't talk about enough, but it really does put a lot of stress on in the entire family when a patient is diagnosed with cancer, and especially for their primary caregiver. And so for the nurse to be able to talk with the caregiver for a couple minutes, either with the patient or separately, and say, are you okay? Are you taking care of yourself? And kind of like we were saying, giving almost that nursing feedback to them. You have to care for yourself too, so you can help care for your family member who's going through this illness, because that's very important. And it's going to be a really hard time, but let me give you some self-care strategies. Let me talk to you about what's going on. And making that connection with the family is just so critical with oncology nursing. And by family, I also mean friends. Everyone has a different care and support system in place. And some people, might not have a whole lot of support. So helping them to get support, linking them with social services and with social work, and referring them to support groups. I think that those aspects of oncology nursing are very unique.
No, I agree. One thing that always fascinates me is how nurses have, obviously, the medical skills and the training, but where do you learn all the soft skills? Because you have the soft skills, but you manage, families and friends and, all that sort of thing, and the intuitive kind of nature of the role. It always amazes me when you talk about, the family, and, where do you learn all that sort of stuff?
I really think most people learn it on the job. And I think that it comes from mentors and watching other people. I feel like I have learned a lot from our social workers that I currently work with.
Okay.
Social work is a field I very, very highly respect, because they are having difficult conversations almost every single day, because that's why you call them, for patients that are not doing well. And seeing them and how they're able to approach conversations, as well as your peers, other nurses and other physicians, I think it is a skill that you learn. I know, when I very first started as a nurse's aide, back when I was still in college, I was nervous even to knock on a patient's door to take vital signs. So I have come a long way, and I know a lot of nurses feel that way. But the first time you go into a patient's room, you think, well, I shouldn't be here. I'm a stranger. And then just in the pace of a couple months, you get so much more used to it. You knock on the door, you introduce yourself, and you say, what you're there for, and you build a rapport with patients, whether it's for one day or 1 year. And it's a skill that develops over time. And I think that it is really unique to our profession, not just oncology, but nursing as a whole. And a lot of other, professions don't have that, because they don't have the opportunity to meet a lot of people in 1 day or 1 year. And I think it's really special.
Yet still, you might only be meeting those people, you say, one day, very randomly, but nursing still comes out as number one as the most trusted profession.
Yes, it does. Yes. And it's been 18 or 19 years, which is outstanding, in a row. And I think there's a reason for that. I think that most people, when they're in a hospital for whatever problem they are experiencing, they're very scared, because they're not there every day. Most people, if you ask them, general people, they're going to say, I hate hospitals. And that's completely understandable. And nurses are there every day to help people, and to not only help them with the technical aspects of care, but the emotional aspects as well, which are really important. And nurses enjoy it.
No, I agree. Obviously, oncology, we spoke about the speciality and a bit about, how do you sort of see the healthcare community in the US developing over the next couple of years? I know there's some significant challenges.
There are, yes. I think that, a lot remains to be seen as far as what health policies are put into place and insurance coverage. But I think that one thing that everyone agrees with is that our population is getting older and people are living longer, which is very good, but we're going to need more people for more nurses and care providers, nurses, aides, and physicians that focus on geriatric care. The number of cancer survivors has grown a lot, which is fantastic.
Great.
A lot more people, a lot more people are living after cancer or with cancer, and they're living good quality lives, but they still need support. And so I think that is going to be a challenge in the future. We need to make sure we have a strong nursing workforce in place that's able to care for these populations. And technology, as we all know, is really rapidly advancing, which is wonderful. And it's allowing us to reach patients that maybe would have a more difficult time, whether they're elderly or without transportation or live in rural areas. And so I think that being able to reach patients who are farther away in non-traditional hospital settings is going to be very critically important in the future.
Agreed. I suppose with an aging population, it's also our nursing population is aging as well.
Absolutely.
So trying to stop them retiring.
I know. And so we need to make sure our younger nurses are strong and specialized or very well rounded, and they're able to do a lot of different types of nursing. And I think that it's unique to millennials. Millennials, and I'm a millennial, I can say this, but we switch jobs more often than a lot of the generations before us. And so I don't know what the exact statistic is, but I think a millennial switches jobs every 3 to 4 years on average, whereas the generation prior only switched every 10 to 12 years. And so with that comes for me a concern, are people going to continue to specialize, or are we going to have more general nurses? And I think that specialization is very important. And to be fair, they could be switching jobs within the same specialty, and maybe that will make them more well-rounded and stronger nurses in the end. So I think that that remains to be seen, but I'm very hopeful for that.
I think one of the worries when we interview people in England tends to be that they worry about there won't be many general ward nurses left, or almost the ward nurse will become a speciality because people want to go into the surgical or into the oncology area, they deep into that speciality, that challenging kind of environment, and there won't be the actual ward nurses that you need.
I agree. I think that we see that in the United States as well. We call them med-surg nurses.
Yep.
But they are general nurses, and we need strong general nurses. I think the good thing about nursing is that it's a very flexible career, that a lot of people partially go into it because they know they can work nights or weekends or part-time and have a family and take care of their family and work different hours. And I think that type of ward nursing or med-surg nursing allows for that. So I think that that'll help keep that specialty strong, which will be important.
Very good. Chris, I appreciate the job you do and all the many, chairs and things you do on top. Do you have any free time? What do you do in your sort of free time?
I make sure I spend time with family and friends. I find that very valuable. And I also exercise a lot. I like running, I like yoga, and I love traveling. And it honestly fits a lot with my interest with nursing. I love meeting new people. And so travel for me is part of that.
Superb. Good stuff. And is there any message you'd like to, to give to our nurses watching?
I would say that if you are in a specialty type of nursing like oncology or med-surg, there's usually professional organizations that you can join. And while they do cost a little bit of money, sometimes your hospital will help to pay for them. And I really think that they are invaluable. I actually only joined the Oncology Nursing Society several years into my career. I had already been an oncology nurse for, I want to say, 3 or 4 years at that point. And when I joined, I thought, wow, I wish I had joined sooner, because they had so many resources for new graduate nurses and younger nurses that I then took advantage of. But I think it's a great support system. It's a great way to network and meet other people outside of maybe your particular area of work. You can meet people at other hospitals and come together and talk about, what are you doing at your hospital? And maybe, we do this, we could improve on this. And I just think it's wonderful for groups to get together like that and provide not only educational support, but also mentorship opportunities and leadership opportunities.
Fantastic. Kristin, thank you so much for your time today.
Thank you.
Thank you for watching The Voice of Nursing. Thank you all for our nurses, our doctors, our allied health professionals, and also our carers for looking after us all. We'll catch up with you again soon.